Hello, my name is Jim Bernatz. I'm one of the orthopedic spine surgeons here at the University of Wisconsin. Today we'll be going over a comprehensive physical exam for the spine patient. I have with me today a medical student volunteer, Josh, who's going to be helping with the exam. We start the physical exam with inspection of the neck and the surrounding musculature. So looking at Josh from the front, I'm seeing if he's had any previous surgeries with scars on the front or the back of his neck. I'm looking for muscle bulk, looking at symmetry between the two sides, looking at his trapezius muscles, his deltoid muscles, his biceps muscles, because if people have a spine or nerve problem, sometimes their muscles can atrophy. Next, I'll ask Josh to do some simple movements of the neck to make sure that the neck moves in a normal way. First, I'll have him flex his chin down towards his chest. Good, and extend his neck, looking up at the ceiling. Then doing rotation, looking towards one shoulder and to the other. And then lateral bending, touching one ear down to the shoulder and the opposite. Very good. The next part of the physical exam is the motor exam. Here we'll be testing each of the cervical nerve roots and the main muscles that they innervate. There's no real muscle innervation for the C2, C3, or C4 nerve roots, so we begin with C5. The main muscle that C5 supplies is the deltoid muscle. First, we'll have Josh lift his arms out to the side, and I am going to oppose him lifting his arms out to the side. Good. Strength is graded on a scale of 0 to 5. 5 out of 5 strength means that he has full strength and is able to fully resist me. 0 out of 5 strength means that the muscle does not fire at all, and there's a gradient in between there. If someone is able to at least raise their arms against the force of gravity, that's a 3 out of 5. And then with some extra strength, but not full strength, is 4 out of 5. Whereas 2 out of 5 is they can't quite get full range of motion against gravity, and 1 out of 5 is just their muscle only flickers, but doesn't really move. So we've tested C5 with the deltoid. Next we'll test the biceps function. So he'll make a muscle, and then I will resist against him as he pulls. Very good. And now we'll test the triceps, which is C7, where he'll push against me. And I forgot to say biceps is C5, 6. Great, we'll do that on both sides, and now we'll look at the wrists. So I'll have him make a fist, putting both wrists out like this, and I'll have him cock his wrists up in the air. Wrist extension, test C6. And wrist flexion, test C7. Next, 2 motions in the hand. I'll have him spread his fingers out all the way, where finger abduction, I'm resisting him spreading his fingers out. Test the T1 muscles. And then squeezing my hands, making a tight grip. Yeah, there you go. Test C8, or grip strength. Very good. That concludes the motor part of the exam. We'll next move to sensory. So now we're going to test the dermatomes associated with each of those nerve roots. So C5 tests the lateral shoulders, where I'll just do a light touch on the side of the shoulders, test C5. And then with his palms up in the air, we'll test C6 by touching over the thumb, C7 by touching over the long finger, C8 by touching the little finger, and T1 by touching the medial forearm. Now, if you want to drill down more on the sensory, you can do vibration, you can do sharp touch, you can do light touch, you can do temperature. But for a general screening exam in the spine office, we generally just use light touch with our fingers. Next, we'll move to reflexes, where I'm going to test 3 reflexes in his arms. So the biceps, the brachioradialis, and the triceps. So with his arms completely relaxed, I'll put my thumb on his biceps tendon, and you can tap and feel that response in his biceps muscle. I'll do the same thing on his brachioradialis, where either with a reflex hammer or my finger, I'll tap on the brachioradialis muscle. And then with the triceps muscle, again, I'll let him go totally limp here, and I'll tap right on the end of the triceps tendon. Those are the 3 main reflexes for the upper extremities. And now 2 kind of special tests that we'll commonly do for cervical pathology. One is called the Sperling's test. So for this, I'll ask Josh, look up into that corner of the room, rotating your head that way. Now in this position, he'd be compressing any of the nerve roots on his left side, and to add to that, I will then press down on the top of his head. If Josh gets a shooting, zinging sensation down his left arm, that's a positive Sperling sign for a nerve being pinched on the left side, and you'd do the same on the right. And the final special test is called Lermit's, where I'll ask Josh to tuck your chin all the way down to your chest And if Josh gets an electrical shooting sensation down the back of the neck and even into the arms or legs, that can be a sign of spinal cord pathology, just such as cervical stenosis, or even things such as multiple sclerosis that affect the central cervical spinal cord. Similar to the cervical exam, the lumbar exam starts with inspection. First, I'll look at the skin of the back to see if there's any changes in the skin or any previous incisions from surgeries. I can then do palpation and press directly along the lumbar spinous processes and the paraspinal musculature. Can also palpate down to the SI joints to see if there are any areas of tenderness. Examining the lower extremities, we'll next look for muscle atrophy in the thigh muscles and the calf muscles, as that can be a sign of nerve root compression. We'll then move on to motor testing. First, we start with hip flexion, where I'll ask Josh to raise his knee up in the air, and I'll press down on the leg. I'll next ask Josh to extend his knee all the way, and I will resist that knee extension. Hip flexion tests L2, knee extension tests L3. Then moving down to the feet, L4 controls dorsiflexion of the ankle, so I'll have Josh pick up his ankle against resistance. L5 controls the extensor hallucis longus muscle, which is big toe extension, so I'll have him pull his big toe up in the air. And S1 controls plantar flexion of the ankle, so I'll have Josh point his foot down against my resistance. Moving on to sensory, we'll test the dermatomes of the lower extremities. L2 is the top of the thighs, so we'll do light touch sensation over the thighs. L3 is medial knee here. L4 is medial shin. L5 is lateral shin and the dorsum of the feet. And S1 is the plantar aspect of the foot and the lateral aspect of the foot here. After sensation, we'll move on to reflexes. So we'll test the patellar reflex, which tests L4 and L5. So we'll have Josh scooch back on the table a little bit so his knee is hanging free. We'll have him relax and strike the patellar tendon. And then the Achilles reflex generally tests L1, so we'll have his foot relaxing free, and I'll strike the Achilles tendon and feel the response in the foot. There are a couple of special reflex tests for the lower extremities that can be signs of upper motor neuron compression or spinal cord level compression. These would be something called a Babinski sign, where you rub the bottom of the foot along the lateral aspect and then drag it towards the big toe. And if the toes extend, that is a positive Babinski sign. And there's also something called clonus. So if you take the foot and force it into a dorsiflex position, if the foot continues to flap with one or more beats, that is clonus, and that can also be a sign of an upper motor neuron problem. The spine exam should also include an assessment of posture and of gait. So now standing, we'll look at Josh from both the front and the side to see if he leans forward, leans backward, or leans to one side or the other when standing. We'll then assess his gait. So first, just a normal walk. We'll have Josh turn around and walk, and we'll watch him from behind, looking at his stride length, the way his feet land, whether he's staggering from side to side. And then we'll ask Josh, okay, now walk on your toes. This tests his ankle plantar flexion strength, so the S1 nerve. Then we'll have you stop there. And now do the opposite, walk on your heels, keeping your toes in the air. This tests his ankle dorsiflexion and his extensor hallucis longus, which are L4 and L5. Great. Now next we'll have Josh do what's called a tandem walk, where he walks one foot in front of the other like he's walking on a tightrope. This assesses the balance function and proprioception, and if this is hard for Josh to do, that can be a sign of spinal cord compression. This concludes the comprehensive physical exam of the spine. Thank you for your attention.